A very good morning to all of my dear friends. In this session, we are going to discuss a very important topic of community medicine, which is Anemia Mukht Bharat. So let's start. Okay, so in this slide, you can see the logo of Anemia Mukht Bharat. In the bottom of this logo, we can see that having a iron plus initiatives. So basically, this iron plus initiative is the another name of Anemia Mukht Bharat. Now in this video we can see that the government of India try to discuss the aim of the Anemia Mukht Bharat. So what is the aim of Anemia Mukht Bharat? The aim of the Anemia Mukht Bharat is to reduce the prevalence of anemia by 3% from 2018 to 2022. Then what happened after 2022? After 2022 it merged with some other program like Poshan program and other programs. After that, we are going to discuss 6 into 6 into 6 strategy. In this 6 into 6 into 6 strategy, there are 6 things that government of India should have to be done. The 6 is the 6 beneficiary. The another 6 is the 6 institutional mechanism, and the another 6 is 6 intervention. So basically these are the 6 into 6 into 6 strategy. After that, we are going to discuss 6 into 6 into 6 strategy. In this 6 into 6 into 6 strategy, there are 6 things that government of India should have to be done. The 6 is the 6 beneficiary. The another 6 is the 6 institutional mechanism, and the another 6 is 6 intervention. So basically these are the 6 into 6 into 6 strategy. Now we are going to discuss the 6 beneficiaries. So beneficiary means basically there are 6 different categories people are included in this Anemia Mukht Bharat according to its age. The first beneficiary is the child of age 6 months to the 5 years. The second is child of age 6 years to the 9 years. And the third is adolescent girl. Now after discussing the 6 beneficiaries, we move forward toward the 6 institutional mechanism. So the first institutional mechanism is convergence with other minister. Now the question is arise, why there is a requirement of convergence with other minister? This is because the anemia is not due to a single cause or having no depend on the single factor. So definitely there is a need of convergence of other ministries, so we can eliminate the anemia according to Anemia Mukht Bharat. So in the diagram we can see that the Ministry of Health and Family Welfare, they try to say his worker, and I mean appeal to all the health worker to distribute the iron and the folic acid tablets, go for the screening, ensure treatments. While the other Ministry of Women's and Child Developments, they appeal to all the Anganwadi workers to distribute packets of food to every pregnant and lactating mother, distribute packets of food to all the malnutritional child, and ensure the proper nutrition. On the other hand, the Ministry of Education, the second institutional mechanism is the intra-ministerial coordination. Let's say this intra-ministerial coordination is very essential to the progression of any program, because for example in image we can see that the health minister conduct a counseling where all the health workers are attended this counselings. Basically they appeal for the anemia mukht mission, and they say to all these workers to do his proper attention in this program, so we can eliminate the anemia. So these all things about the inter-ministerial coordination. Now after that we go for the third factor, that is the strengthening supply chain and logistics. So here we can see that at the PHC centers the senior officer talk to his all the workers present at the PSC levels. So basically in the discussion, their role is to ensure the supply of folics and iron supplement properly. So no any patient or any ladies having a deficiency of iron and folic acid, they suffering for the anemia. So the main role of this main program, according to this program, is the proper supply of folic acid and iron tablet at HPSC center. Okay. Now the fourth thing is the National Center of Excellence and Advanced Research on Anemia Control. So basically this is a very big laboratory run by the government of India, and the aim of this a very big laboratory to diagnose the anemia or any other disease. So in the image we can see that some researchers are try to diagnose the non-nutritional cause of anemia, and they try to differentiate what are the nutritional cause of anemia and non-nutritional cause of anemia, like sickle cell anemia, thalassemia. On the other hand, you see in the image that some researchers also try to find the best medicine therapy for the treatment of the anemia. Some of them try to develop any best diagnostic process. So with the help of this National Center and Excellence at the national level, the government of India try to reduce the prevalence of anemia. Okay. Okay, so fifth thing is the National Anemia Mukht Bharat Unit. So what is this National Anemia Mukht Bharat Unit? You see in the image that they are from the different states, the health worker collect the data of prevalence of anemia, and they give this data to a main senior employee. So at the national level, there is a senior health worker who collect the data of the prevalence of anemia from the different states, and on this basis they try to find out what are the prevalence of anemia at the national level. So these are the work of National Anemia Mukht Bharat Unit. And the sixth things is the Anemia Mukht Bharat dashboard and the digital portal. So on the screen we can see that a person seeing all the data of the anemia, like its diagnosis, total number, the prevalence, how to prevent it, sign and symptoms. So this is the dashboards. On this dashboard, all the data related to anemia are available. So anyone go and find this data and study it. Now, after discussing the six institutional mechanism, now we proceed towards the intervention. So, what is the meaning of intervention? The intervention means basically the people try to do to reduce the prevalence of anemia. So, the first intervention is supply of iron and folic acid by the government of India. So, in the image we can see that the ASA worker supply the iron and folic acid tablet to the villagers. So these are the first intervention, that is to supply of iron and folic acid tablet to the ladies or the girls, or what are the beneficiaries that comes under 6 into 6 into 6 strategy.
Okay, so now the fourth thing is the testing for the anemia. So in the image we can see that there are some instrument used for the testing of the anemia. One of the common is the digital hemoglobinometers, and in common day we having a mobile phone app through which we can use as the testing of the anemia. The fifth thing is the iron folic acid fortified in public health program. So basically in this programs, the government of India ensure that the addition of iron and folic acid tablets in the regular diet of the human beings. For example, we generally eat the wheat and the rice. So government of India decided to add the iron and folic acid as a nutritional supplements to our daily routine diets. This process is called the fortification.